So Dr. Bilski, in my own travels and ventures into the dental office, which it happens every 6 months, that's right, I've had a chance to meet a dentist. I've had a dental hygienist, even a dental assistant. I thought maybe, could you explain, what are the functions of each? Why are there 3 different types and what are the differences?
Okay. No, that's a great question. It's not so much a hierarchy, but it's all licensure based.
Okay.
Like, what can the dentist do? A dentist diagnoses, injects, prescribes, treats, runs the drill. So reversible and non-reversible procedures. Okay. A dental assistant, there are different licensures or status, whatever you want to call it, of dental assisting. So dental assisting, if you went through a program, you'd be registered or certified in taking x-rays,
okay,
sterilization, and helping the doctor suction, set the rooms up. Then there's the next level, which is a expanded function dental assistant, EFTA, EFDA. They go to school for additional training that allows them to do things like place fillings, okay? Make temporary teeth. So a filling is considered reversible. So they're not drilling into the tooth, but they may drill the filling to reshape it,
okay,
or the bonding.
Yeah.
Take x-rays, take molds of your teeth, use the scanner to take digital impressions. There's probably some things that I'm missing also. And then there are the dental hygienists, which there are dental hygiene is a 2 or 4 year degree. You are licensed to clean teeth, and if you go on for an additional certification, you are licensed to give injections. So we talked in one of the previous videos talking about recession or scaling and root planing.
Yeah.
So traditionally, before, doctors used to have to come in and numb you if the cleaning was sensitive. Now the dental hygienist goes for additional training and can inject him or her, whoever that hygienist is, the patient, and go on. So I don't need to go in to the room anymore.
Yeah.
So it's expanding their duties based on licensure and certification and training.
So you can treat more people, but also it's like, again, obviously you're highly trained, and there are some things that you don't need your level. So why would you have your time in there? That just makes sense.
No, that's true. And so here, 2 ways to look at that. It could be good for business, right? Yeah. But more importantly, as patients, they have time constraints themselves.
Sure, absolutely.
So if you have to wait for me to come in to have your temporary tooth put back on, where we already know that the dental hygienist or dental assistant can do that.
Yeah, right.
Then just have the dental assistant or the F to do that.
Yeah.
You don't need to have me break away from a procedure that maybe somebody probably shouldn't be breaking from that appointment.
Sure.
It's just then they're thinking, like, where's he going? Why is he leaving?
Yeah.
Which has been dentistry anyway for many, many years, but that is one reason. Now there is the unicorn out there that we love. It's the dental hygienist. That's an EFTA that went to phlebotomy school to learn how to draw blood. Now there's the unicorn.
That's the triumvirate. What's the drawing blood that's.
Well, when we're doing surgery, I can send her in there.
Oh, okay.
Like a nurse or a phlebotomist when you're in the hospital. So to equate that with the hospital, there's the doctor, then there's the nurse practitioner or physician's assistant.
Yeah, right.
They're kind of like the doctor, but they're not the doctor.
Right.
Can they prescribe? Yeah, they can prescribe on their licensure. The EFTA is not like the doctor, but can do procedures that dentists typically would complete or finish towards the end of the appointment that are reversible. So it may not be the greatest analogy, because I don't want to pump up any dental assistants thinking that they're a physician's assistant, because that's not what I'm saying.
Yeah.
What I'm saying is that it just helps get you through the process where, like in hospitals, you can be, and if something's really bad, that's when the doctor comes on.
It just makes sense. But yeah, I appreciate you kind of not clearing it up for me, but it's kind of what I sort of imagined. But it is interesting to hear how much training they have to go through at each level.
The
And it's
difference
reassuring too.
Yeah, 34 years of doing this, 35, whatever it is. Dental assisting is not what it used to be. And
It's not just, okay, you need this, Mr. Dentist, you need this, Mr. Dentist.
No, these ladies in our office, ladies, there are men dental assistants. A lot of them come out of the service, dental assisting from Army, Air Force, Navy, Marines, and they're fabulous. The point being is that you have to know technology, you have to know what to anticipate that the doctor is going to do in a procedure, restoratively, surgically, root canals, orthodontics, just your normal everyday handling emergencies.
Well, it's interesting to hear, and thanks a lot for sharing with us.
Welcome,
Appreciate it.
Sure.